Hello everyone, it's Dr. Wendy Fortna back here on Thursday, July 23rd with your COVID-19 update. As you are well aware from watching the news and the government websites, we are getting increasing number of cases across all of Central Zone, and Hanna has that as well. I want to reassure you that we are all still healthy in our medical clinic as well as our hospital. We do not currently have any patients admitted in the Hanna Hospital with COVID-19, so if you have an appointment for lab or x-ray, even though we always take precautions, you can rest assured that we are able to serve you in a healthy way at this time. We had some interesting questions come up lately around the questionnaires that we are asking people to complete whether they enter the medical clinic or the hospital. Questions around why we are asking specific information regarding your health and whether or not we can do that when it's not the physician asking you those questions. This particular set of information that we're asking from you is to help us decide how we can see you in these facilities in a safe way. So we're going to ask you questions that help us decide if there's a chance that you might have COVID-19. So these questions are going to be things like, do you currently have a runny nose, a fever, a cough? Have you been outside of the country in the last 2 weeks? And if you answer yes to any of these questions, it doesn't mean that we're not going to see you, but it means that we're going to take additional precautions when we do have a visit with you, whether it be in the medical clinic or up at the hospital. It's extremely important that you answer these questions honestly, because if we end up having our healthcare workers or anybody involved in the hospital who encounter a patient without proper protective equipment, who comes back to be positive, then that staff member is off work for 14 days. As you know, we don't have a huge staff here in Hanna with only 4 physicians and only a handful of registered nurses. And if our staff start being off, we end up having to close our hospital. So I really would request that everyone who comes into our clinic or our medical facilities, please answer those questions honestly. I can for sure assure you that you will be seen, but we may put you in a different part of the hospital or here in the clinic in our special isolation room, where we then wear eye protection and a gown when we see you, just to make sure that we are safe when we go to see the next patient. That would be very much appreciated. Please continue to submit questions to the Hanna Medical Clinic or to the town of Hanna, and I would be happy to answer any more of them that you may have. Otherwise, stay well, and I'll be back next week.